Hello and welcome to Business Insider with Mario Toneguzzi on YYC Business, brought to you by MegaPixx Media. Joining me today is Julie Gaudry, who is Head of Group Benefits for RBC Insurance. Thanks for joining us, Julie.
Thanks for having me today.
Well, I'm interested in a survey that RBC did recently on a number of things, but mostly, regarding workplace benefits. But the one thing that caught my attention was 68% of Canadians would take a job with benefits, good benefits, over pay. Did that surprise you?
Yeah, I think we've known for quite some time that benefits is important, right? It's been up there with other reasons that people consider and as they make a change for jobs. But I think what we saw throughout the survey from that finding you cited in particular and others is that people are putting a greater focus on their benefits plan and how it supports their health and well-being. And that's just become increasingly important over the last year or two in light of everything that's going on around us. So something that's definitely of importance and something we need to keep in mind as employers and as the group benefits providers that support them.
Now, when you're talking about group benefits, we mostly think obviously like medical, prescription drugs and your dentist, et cetera. But are there other things that people today are looking for in those benefits packages?
Yeah, so you're right. Those would be the traditional benefits people think of when you say I have group benefits. And in addition to, that coverage to have your prescription drug covered or to see the dentist or to see a psychologist, you also have important coverage for disability in the event that you're unwell enough not to work. And those are all important considerations and something that we know people place a ton of value on. In addition to that, though, they are looking for additional supports, right? The role we play as a group benefits provider has grown in terms of supporting the health and well-being of plan members, the employees who use those services. And it's not just about paying claims when they have one. It's about how do we provide services to help them lead a healthy lifestyle each and every day. So the additional things they might be looking for are aspects of their benefits that allow them to personalize what they need based on their unique circumstances. So maybe that's a flexible approach to their benefits coverage. Maybe it's a wellness spending account that allows them to have coverage for expenses that help them lead a healthy lifestyle. Yeah. Maybe it's providing platform to connect virtually with a healthcare provider to address the needs that you have. So they're looking for more than beyond just the traditional, for sure.
Yeah. So when you looked at that survey, I think one of the things that it mentioned was the fact that younger workers, younger age groups are more in tune with that sentiment. Why would that be?
Sorry, I lost you just at the beginning of that question there for a moment, but I think we spoke about why younger workforce would feel more inclined. Yeah. I think that there's a few things going on there. The younger demographics. So for us, we looked at the data and looked at it for those under 35. So one thing we heard about that group from our survey data, and we see in our claims data as well, is that they have a greater focus on their mental health needs. They are self-reporting a higher level of poor mental health than their older counterparts. And so one aspect is that there's a greater need amongst that demographic that we need to support. The other thing is this group of employees, has grown up with a more digitized, automated, slick employee experience in terms of acquiring goods and services, and that translates to their expectations in their group benefits offering and what they expect their employer to provide. And so, as that proportion of the workforce grows, they are already a significant proportion today. But as that younger demographic becomes a bigger and bigger proportion of the workforce, we need to make sure that we've got the services and the options that are interesting to them.
Yeah. When we're talking about things like the importance of, say, wellness benefits, what kind of things are we talking about there? Like that are sort of specific examples of what people, and maybe some of the trends that you're seeing in the industry.
So in terms of what would be maybe covered under a wellness spending account, or more broadly speaking, just wellness related support?
Yeah, well, wellness related support in general.
Yeah. So there's a few things we're seeing. One I mentioned already, so wellness spending accounts, or they also go by the name personal spending account, lifestyle account. They're essentially a vehicle that an employer can use. It's group benefits coverage, but it's on a taxable benefit basis. And employees can pick and choose whatever they want to maybe use the funds within that for. So if somebody is using it for workout classes, perhaps they're seeing a counselor, maybe there's some nutritional supplements they might need. There's a variety of things that they could use, pay for hobbies and recreational activities, anything that would support their health and well-being could be an option. So that's one avenue. I mentioned as well virtual care, and that's grown. It was already on the rise prior to March 2020. But once we had a disruption to our typical face-to-face delivery of healthcare, you saw a significant move towards virtual delivery of care because practitioners needed to find a new way to connect with their patients when they couldn't see them face-to-face. So you saw a lot of growth in that virtual healthcare space. And so we right away in 2020 introduced some opportunities for people to connect virtually with mental health experts, whether that was video counseling or whether it was online self-serve modular type support that they could do guided by a therapist through text or chat. So that was one option. And then this year in 2021, we added the opportunity to have virtual primary care, so the ability to visit with a physician via video. So these are areas of interest and focus. They don't replace face-to-face care. They're another option so that we remove obstacles to accessing the care that people need to lead a healthy lifestyle and recover if they're facing a health challenge.
Okay, the last thing I wanted to ask you, Julie, can you talk about the business sense of this and why, from a company's business standpoint and their bottom line, I guess, why it's important for them to have workplace benefits programs that meet the needs of their employees?
Yeah, so we started off the conversation about 68% saying that they would take a job with a good benefits plan over one without, even for higher pay. So we know it's important, but more broadly speaking, why that's increasingly important now is, the focus on attracting and retaining good talent. We're in an interesting labor market right now, courtesy of the events over the last year and a half or so. Some industries have been significantly disrupted and are facing labor shortages. So they need to find ways to attract workers. Workers themselves may be reevaluating what they want out of their career and the type of employer that they're going to work for over the last year and a half with a bit more time on their hands. Maybe they've come to realize how they really want to spend that time. And as well, just with pandemic related restrictions and the burnout that comes with that, we're seeing accelerated retirements and just, people leaving the workforce, unfortunately. And so, there's a need for talent, and employers know that the best way that they can have an engaged, productive, and loyal workforce is to show that you care about their health and well-being. So that means your policies at work, but it also means the benefits and the services you provide to your employees, and group benefits is one of the ways you can do that.
And I guess, like, for the people, like when you have an employee, right, if you have good programs in place that can keep them there in terms of keep them working, as opposed to sitting out for 2 weeks because they're sick or whatever, right? That all hits the bottom line in terms of productivity and replacement costs, you name it, right? So that's got to be a big benefit as well, right?
Certainly is. So, the reason why an employer is going to implement or grow their wellness solutions and the supports they have in place for employees is exactly for a couple of the reasons we talked about. One, to help drive employee engagement and productivity while they're at work, but certainly to help address any health needs they may be facing, perhaps address something long before it becomes serious enough for people to no longer be able to work. And so health improvement and prevention of future claims is an important focus for employers as well. So you really want to make sure you have the resources in place for your employees when they start to face something challenging that they might need support with.
Yeah, exactly. Well, thanks a lot, Julie, for joining us today.
Thanks for having me.
All right, that was Julie Gaudry, who is head of group benefits for RBC Insurance. This has been Business Insider with Mario Toneguzzi on YYC Business, brought to you by MegaPixx Media. Thanks for joining us.